Om Sairam to our listeners. Welcome to Saturday News number 838. And today we'll be hearing part one of three parts on the topic of mental health. On the 9th of May this year, mental science professionals met and discussed on the topic of mental health professions for Sai community. So this was done in USA. So we have Sister Suzanne Slamon, Dr. Jack Fairley, and Dr. Phil Gosselin. So these three Sai devotees will be discussing on the topic of mental health professionals for Sai community. So I think we should get straight into it. Let's get started.
Session for this evening is mental health awareness, and it is the month of May is always the mental awareness month in the United States, and it's been observed that way since 1949 onwards. And it is the time to come together and learn about mental illness, for people who are going through this to understand different methods and cures, and for those who have family members or friends going through these kinds of situations, it's also good for us to educate ourselves so that we are in a position to support and help them. To discuss this topic today, we have a very esteemed panel, and I will introduce the moderator. It's going to be Ravi Yagyaraman from the Boston area. He's grown up in the Sai fold and currently serves as the Region 1 YA rep. I will pass it on to Ravi to introduce the topic as well as the panel for this evening.
Thank you, Shrikant. And Sairam, everyone. Tonight we're going to be talking about mental health. And one of the reasons we're going to be talking about mental health tonight is because it's not a topic that we typically talk about at Sai Center. But tonight we're fortunate to have three incredibly experienced panelists with us who are going to share their perspective on why a better understanding of mental health can be beneficial for us, not just for our own well-being, but also for our spiritual growth. And each one of our panelists tonight has decades of experience, both as mental health professionals, as well as decades of experience interacting with Swami and serving in the Sai organization. Now, the structure for tonight's panel, it's going to feel a little bit like going to a very fancy restaurant. We're going to serve you a series of courses on different aspects of mental health. And each one of these courses is going to be around a 5-minute segment, and it's going to be specially prepared and delivered to you by one of our panelists tonight. And so we're going to cover a good amount of material tonight, and that's a good thing. We hope that by covering a variety of topics, that there will be something to take home for anyone who's tuning in tonight. In terms of how we came up with the topics for tonight to talk about, we spent some time speaking with devotees from across the country to understand what are the issues people are currently going through with regards to mental health. And so everything we're going to talk about tonight is directly in response to situations and issues and questions that members of the Sai community are currently facing. I can give you a quick sneak peek of some of the things we'll talk about tonight. We'll talk about the stigma of going to see a therapist. We're going to talk a bit about the boundary between when we can handle feelings of stress and sadness on our own versus when it may be more appropriate to seek professional help. And we're going to talk about what we can do to care for our own well-being as well as support those around us. So without further ado, I'll hand it off to our panelists, and we're first going to hear from Dr. Phil Gosselin. And Dr. Phil Gosselin is currently the chairperson for Zone 1 of the Sathya Sai International Organization. Dr. Gosselin resides in Amherst, Massachusetts, where he is a clinical psychologist in private practice. He's previously been a professor of psychology at Union Institute and has been the director of behavioral medicine department at the Franklin Medical Center in Greenfield, Massachusetts.
Thank you. Thank you very much. Welcome, everyone. We're happy to have this chance to share with you. Of course, mental health is such a vast field. It's going to be very hard to cover very much of it in 1 hour. So this is just a few themes from the questions that Ravi had gotten back. and a few themes that we'd like to share. And I have a particular theme I'd like to share, which is about spirituality and psychology, or spirituality and psychotherapy. I hope this will be of interest to you also. Starting out, you know that Swami says the proper study of man is man. So we are a fascinating, mysterious subject for ourselves. And eventually these kinds of inquiries as to what is the nature of ourself, what's our nature, leads to the all-important question of who are we? Now, so I'm enthusiastic about my chosen profession in psychology, and I want to, and as we're speaking to spiritual aspirants, I wanted to highlight some of what I think of as spiritual elements in this field. In the past, psychotherapy was seen as unfriendly to spirituality and even scary and judgmental. And I had an experience with, my cousin was coming to visit me at a therapy conference in Washington, DC. And he's quite eminent in his field, but he was quite nervous when we were there. And I asked him why, and he said, all of these therapists here, they must be seeing right through me. They must be understanding all of these negative things about me, which is not the case. And the whole field has gotten much more humble and much more user-friendly in the past times. So, for instance, in the 1950s, Zen was very influential in psychotherapy. A number of influential psychotherapists were quite taken with Zen. And in the 60s and 70s, the abilities of yogis to change the things in their autonomic nervous system actually helped engender the whole new field of behavioral medicine, which says that how we think affects our physical health in ways that weren't previously accepted. Further studies have been done on TM, very influential at Harvard. And also currently there's a great interest in mindfulness meditation in the field. But what I really wanted to say is about cognitive and behavioral therapy is the dominant form of therapy these days. And I think it's quite compatible with a spiritual life. And I say this because cognitive therapy, basic tenet is that we're all thinking all the time. And which of course fits with, you know, what we're learning from Swami. And that a lot of these thoughts are unhelpful, unuseful, repetitious, and ultimately boring. And so it's useful to find out what they are and to clear them away. And this type of therapy can be helpful in terms of peeling the onion, peeling away our thoughts until we have a little bit more sense of our inner self. And the behavioral aspect of it means that what we do affects our mood and mental health. Now, this is obvious to spiritual aspirants, but it's quite revolutionary in American society. And it means that if there are things that we do which will help, you know, like getting good sleep, eating correctly, having good work and things like that, these things all help our mental health. So it's just good mental hygiene. But this can be quite revolutionary in the sense that you can take it farther and farther. You can break down all of the different things that we do. Is this thing that I'm doing helpful? Is this thing that I'm doing getting in the way? Is this thought that I'm thinking helpful, or is it getting in the way? Sort of gradually peeling away those kinds of things. So, as you know, Swami says, watch your words, actions, thoughts, character, and heart. And so Western psychology is very much tuned into actions and thoughts. They haven't quite gotten to a little bit about the words as being powerful, but they haven't quite gotten to an ability to measure character and heart. And so this is some of the coming attractions in the field. So even further than psychotherapy is a much more user-friendly version called counseling. And this is something that you may be called to do with people. People see you as someone who's serving and loving. They may approach you. They may want to tell you their story. They may want to ask advice. In a sense, you're an informal counselor. And even further than counseling is a new tendency to approach this as coaching. And coaching is, I think, very, very user-friendly because we know that the coach sometimes can be surpassed by the athlete, and most likely is. So it's less hierarchical, and it means that we're all in this together, and that we all have issues. That's why we're here and incarnated. And so I'm going to let this stand for now. I'll speak to you further. And Ravi, back to you.
Thank you, Dr. Phil, for that great overview of therapy and tying it especially to spirituality. I'd like to next turn it over to Dr. Jack Feely to talk a bit about contextualizing mental health given the current pandemic we're going through and what its relevance is to that. Dr. Jack Feely is currently the central coordinator of the Sathya Sai International Organization, United States. Dr. Feely is a psychologist with a clinical practice in St. Louis and an organizational development consulting practice working with corporations around the United States. He's previously been director of a substance abuse outpatient treatment program for adolescents and young adults.
Thank you, Ravi. You know, I would guess that most of us, I certainly am, most of us have been feeling some stress reactions over the past 8 weeks due to the COVID-19. What I want to do is share what stress is and how it's different than anxiety, even though some people use the same words to be or both words to mean one thing. It is quite different. And I want to talk about some of the stress reactions that many of you have been feeling over the last 8 weeks. Stress is quite simple. Stress is the body's reaction to any change that requires an adjustment or a response. And the body reacts to these changes through the physical, the mental, and the emotional responses. And stress, it's important to know stress is a normal part of life. There's what we've been feeling, well, a lot of us have been feeling distress. And this is stress that gives us an unpleasant, uncomfortable feeling. But there's also something called eustress, E-U-S-T-R-E-S-S. EU is the Greek preface for good, like in euphoria. So many of you felt eustress, like good stress. Oh, let's say when you got married, or when you had your children, or let's say you got a promotion, or you've been waiting for you go on this long-awaited vacation to a wonderful place, and you're having reactions to it, but it's good, it feels good, and it's good for the body. Distress does not feel good, and frequently distress hurts the body. But now anxiety is different. Anxiety is different from stress. Stress is more like fear. Stress or fear is directed at some concrete external object or situation, and the event that you fear or you're stressed about is within the bounds of possibility. For example, let's say you're at work and you've got deadlines to meet and you feel like you're behind. Well, it's possible you may not meet the deadlines, or let's say you're a student and you're stressed about failing a big exam. It's possible you might fail the exam. So these things are possible. Or let's say you have this fear of being unable to pay your bills due to certain problems that came up. It's possible. Or let's say you're stressed because you or a loved one you fear may be infected with COVID-19. That's possible. That may happen. Anxiety is different. On the other hand, with anxiety, you cannot specify what you're anxious about. The focus is more internal. It seems to be a response to some vague or distant or unrecognized danger. It might even be losing control. I remember one time I was working in my clinical office with a young woman who was in training to be a flight attendant. She was referred to me because she was having these stress reactions. And as I talked to her more, she wasn't afraid that the plane would crash. Apparently, as I learned, she had a history of panic attacks. And she had this dread that she might have a panic attack while she's on the plane working. And that's very different than stress. Now, I had to work with her very differently. You know, it's a lot more difficult to work with somebody who's having who has a history of anxiety versus stress reactions. With stress affects us in 4 different ways. I'm going to describe some of the physical stress reactions that we all may have, especially over the last several weeks. Now, you may not have had these, you may have them all, you may have had some of them. Let's say some of the physical stress reactions affect the body, muscle tremors or twitches or headaches. Some people talk about a stress headache that they have, or some people get nauseous and they feel sick under a lot of stress. Certainly a lot of people feel like a rapid heartbeat, or maybe they're elevated blood pressure, or sometimes difficulty breathing. They don't feel like they can catch their breath. Some people get cotton mouth, a dry mouth, and they feel very thirsty when they're under a lot of stress. Some people start grinding their teeth and they don't know it until they wake up the next morning and their jaws hurt because they've been grinding teeth all night. And some people say during the afternoon they experience profuse sweating. So this is the body reacting or having some reactions to stress. Now there's cognitive or mental reactions to stress. It could be something like increased confusion, or it's hard to pay attention when you're under a lot of stress. You might even have poor decision-making abilities during this time. So if you're under a lot of stress, don't make big decisions. You might have this heightened response or alertness, or it's difficult to concentrate. It's hard to solve problems that maybe you could easily solve in when things are calmer. Maybe disturbed thinking, sometimes nightmares. So there's a lot of different cognitive, mental reactions to stress. The emotional third, some of the emotional reactions to stress could come across as anxiousness or fear, agitation, sometimes depressed feelings, sometimes inappropriate emotional responses, or we start to get irritable. We even start to get angry and we're not quite sure why, but these things are happening. And then the fourth would be behavioral responses to stress. You might start withdrawing from friends or withdrawing from doing activities that used to bring you joy. Or you might even have some emotional outburst because things are building up and it's coming out in behavior. You might experience a loss of appetite or maybe an increased appetite. You know, many of you have had sons and daughters in freshman year in college. They come back and they talk about the freshman 15. They gained 15 pounds during that freshman year in college. Maybe it's stress. Maybe it's hunger eating. You know, there's a lot of comfort food available. Well, don't let the COVID-19 cause you to add 19 pounds of comfort food. It's hard to get rid of after a while. Some people who are alcohol drinkers might start increasing the amount of alcohol. Some people under a lot of stress start overusing medications or abusing medications. Some people have an inability to rest, or let's say you start to get startled easily, like you just jerk. Somebody says hi and you look and you're startled. This could be stress coming out or intense pacing. So remember, stress is the body's reaction to any change that requires a response or an adjustment. And it's important to realize for stress, it's a normal part of life. If we had no distress, I fear we would have no eustress, good stress. So a little later, I'm going to talk about some of the self-treatments we can do for these different stress reactions. Thanks, Ravi.
Dr. Jack, thank you for the primer on stress. Very topical for me. I get very stressed in public speaking things, so I feel like I could relate to some of the symptoms right now on the phone. I want to hear next from Suzanne, our third panelist from tonight, who's going to talk a bit about going a step further in terms of different ways we may react to stress. Suzanne Slyman has been active in the PSI organization since 1989, having served as an SSE teacher, center president, women's regional young adult advisor, regional vice president, and regional president for Region 7. Suzanne holds a bachelor's degree in education and a master's degree in clinical psychology. She has a private practice as a psychotherapist since 1974, specializing in working with adults, young adults, and groups.
It's been really interesting to listen to Phil and Jack talk and feel like I'm getting to know them a little bit in a different way. So I don't want to repeat a lot of what's already been said. I think that we're all pretty much aware of the fact that we're living in a kind of unusual condition right now. We've lost a lot of our ordinary freedoms. We're kind of under a cloud of uncertainty, really, that is at odds with our pretend, I think, that we have certainty in the first place. But it's been, for many of us, a kind of a rude awakening. So the fact that we might be feeling a little off balance is completely understandable. It's actually not only understandable, it's kind of useful, because there's nothing that happens that isn't, in one way or another, an opportunity to move us further along our path. And whether you think of that in terms of spiritual path and realization, or you think of it just in terms of psychological peace of mind, these opportunities are very, very, very valuable. What I'd like to add and focus on a little bit more deeply in this little segment is how it is that we human beings respond to stress. You know, it's a lot, we have, as I said, this illusion of control, but in fact, I mean, until we're realized, and some of you out there, sorry, some of you out there may be, so you're not subject to this, but for most of us, we're still very subject to causes and conditions. And when we feel threatened, when we lose our sense of safety, some things that are kind of below the level of conscious control take over. And so I want to talk a little bit about how that happens. And that means looking a little bit at our nervous system. And I don't want to go into a lot of technical detail about that. I want to just do it in a more kind of practical and experiential way. So when we feel safe, when we are centered, when we are kind of operating under the illusion that we have a lot of control, I think, then it's easier to feel connected. It's easier to be loving. It's easier to be generous. It's easier to sleep at night, and it's easier to connect with people in a fairly joyful way. We're more forgiving. We see the innocence in people's behavior. We just know that when somebody is out of sorts, that they are temporarily caught up. They're feeling in a low mood. They're a little off balance. But for us as individuals, when we're in that state, we can accept all of that. We're not reactive. We're able to respond. What this COVID crisis has done is it has thrown us as a culture into a sense, and a worldwide culture, into a sense of threat and lack of safety. And what our nervous system does, whether we like it or not, no matter what we're thinking, we go into a sense of response to danger. We, you know, Swami always talked about be human, don't be animal. but threat throws us into, as long as we think we got to keep this body, threat throws us into a sense of reaction and fear when our life is threatened. And or our life, our safety, our livelihood, all those things that Jack and Phil have remarked about. And when we're in a state of fear like that, when we think we're in danger, our first response, no matter how evolved we may think we are, our first response is fight or flight or freeze. We want to defend ourselves. We want to push that danger away. We might want to run away, or we might try to cling to another person, but we're trying to save ourselves. And that might sound kind of extreme, but on an emotional level, that's what's going on. And if it gets persistent enough for long enough, it can wear us out and we really go into collapse. And it's why in times like this, we see more people getting severely depressed. We may know people or hear about people who feel like life just isn't worth living anymore. They're looking for a way out. They feel overwhelmed. I think what I want to have you take away from this is that this is normal. It's because we may be embodied divinity, but as I said, until we're completely identified with divinity, we're having a human body and in some ways animal response to threat. It's normal. We should forgive ourselves and all those we live with and around us, and just accept that that's where we are. I mean, I would just say it can change from day to day, actually, depending on how much sleep you got, or maybe your computer wouldn't go on and you have to work from your computer. Just little things like that. And so I didn't pay attention to the time. Ravi, how am I?
You're doing great, Suzanne.
Okay.
We can this may be a great segue to, and thank you for the primer on how we typically react to stress. That was really helpful, Suzanne. I'd like to pass it back to Dr. Phil, actually, to tell us a little bit about some things we can do. And in particular, Dr. Phil, I know you're a big proponent of the power of listening.
Yes.
Both ourselves and others.
Okay, dear listeners, so we have come to the end of part 1. So next week in part 2, we'll be hearing on the power of listening, and we'll continue on that. So salam to you all.